In this video, let's talk about one of the most commonly performed procedure, microvascular decompression. As we discussed earlier, trigeminal neuralgia is a chronic facial pain syndrome that affects trigeminal nerve, which is a nerve responsible for sensation of the face. In cases where medications fail to give adequate pain relief, your surgeon may offer surgical options to treat trigeminal neuralgia. One of the most effective treatment and surgical option is microvascular decompression, where your surgeon moves the blood vessel away from the nerve and places a Teflon patch in between the blood vessel and the nerve so that the pressure of the blood vessel doesn't pass on to the nerve. During the microvascular decompression procedure, your surgeon places a small incision just behind the ear, as you see in the picture, and we open the skull in a very small size of around 2 to 3 centimeter in diameter. Then we go inside to visualize the nerve and blood vessel, and we separate it and to place a Teflon patch in between them. In most of the cases, after the procedure, the patient is discharged in about 3 days' time, and usually they resume their normal activities immediately after the surgery on the same day sometime, and they usually resume back to work in 1 to 2 weeks' time. In experienced hands, the surgery is quite safe, with complication rates of around 2 to 3%, which means in more than 97-98% of times, it's a quite safe procedure without any complication. If you suffer from trigeminal neuralgia and the medications are not effective, please consider consulting a neurosurgeon and discussing about surgical options available to you. In most of the times, for most of the patients, microvascular decompression is quite safe and effective procedure.